Good day to everyone. In this episode, we are going to analyze for the successful treatment of cancer who is responsible, whether the modern medical equipments or the medical man who is going to give treatment to the patient. If you see in this world, there is a lot of development in cancer research and the development of modern equipments for the treatment of cancer. In every field of cancer, there are a lot of advancement. To take an example in surgery, from the standard surgery, now it has been transformed to minimal access surgery, then it has become a robotic surgery like that today. If you take radiotherapy, from the conventional 3D radiotherapy, now it is IMRT, IGRT, stereotaxic therapy, etc. Then it is chemotherapy, from the toxic agents to non-toxic agents, now it is targeted therapy like that. Like that, the treatment is going on, increasing. And how does it matter to the patient? A patient, when the treatment cost and the investigation cost is also increasing, the treatment cost also goes down. The odds goes up. See what happens, the entire burden finally falls on the patient. Where it is a sophisticated investigations like previously we were used to diagnose only with the X-ray chest, ultrasound. Now we have got a CT scan, MRI, PET scan, so many scans are available. Then the investigation cost is going up and the treatment cost is going up. The final burden is going to lie on the patient. And the next on the other side, the human doctor who treats the patient. Now, for example, if you see the modern equipments, you may say now the artificial intelligence is coming up in a big way. So, if you feed all the investigations to the artificial insemination computer, the computer will give the treatment. That can be carried out. It's okay. Similarly, when you go to a surgeon or a physician, there's a personal bias in this world. A surgeon or physician may do what is necessary for him, what is known to him, and what will be beneficial to him as well as to the institution which he belongs. This is called a human bias. To eliminate the human bias only, the artificial intelligence has come. That is why the people were confused whether to believe the artificial intelligence report or the doctor's advice. So you have to balance between these two. For example, if you believe only on the equipment, you may not require a robot to remove a small swelling in the scalp, which can be done very easily with a small surgery. At the same time, to remove a complicated case in the brain, in the liver or something like that, you may use the requirement of a robotic or the use of the sophisticated investigations, etc. Like that. So you have to decide. Who is going to decide? What the artificial intelligence tells, it gives the report depending upon the feedings, depending upon the materials, depending on the information you have fed into the computer gives the results. But who is going to feed? It is the human brain. So an unbiased doctor, a doctor who is ethical in his practice and who wants to do what is necessary for the patient, who wants to use the correct investigations for the patient and correct treatment for the patient, the best person, because he can give you what is necessary, whether this sophisticated investigation is necessary to this patient or not, whether sophisticated investigation or treatment is necessary to him or not. So if he decides like that, and it will give the best treatment to the patient at a very, very affordable and reasonable cost. That is why, in spite of the modern equipments and modern developments of cancer treatment, it is a human brain. It's the doctor who treats the patient is most important, and the doctors with the ethical, and he must suggest the best to the patient whether to use the sophisticated investigations or optimal use of such investigations and the modern gadgets for the successful outcome in the cancer management. This improves the doctor-patient relationship as well as the faith of the patients or the doctors. So always a human is superior to a machine ever and never.